All characters appearing in this work are fictional. Any resemblance to real persons is unintentional. This video features the Integrative Screener version 2.0. The Integrative Screener version 3.0 is the most current version and is available for use. Some features of version 2.0, portrayed in this video, have changed. Please refer to the brief and full user guides for further specifics, available on our website, communitycollaboration.umbc.edu, or contact our center. To highlight and clarify important information during the interview and feedback demonstration, you will see TIP or Attention appear at the bottom of your screen.
Well, hello, Mr. Jones. My name is Henry Gregory. I'm going to be working with you today for a little bit.
Okay.
Michael Jones, is it?
Yes.
Okay. Do you mind if I call you Michael?
No.
Okay.
It's okay.
Okay. So we wanted you to go through the screener today, so we can get some idea of what your needs are, what your experiences are, so we can best serve you.
Okay.
So I'm going to be asking you some questions about variety of subjects, and answer as honestly as you can. And if you'd rather not answer, you can say that also.
Okay. And the purpose of this is for what?
So we can get to know you, see what your needs are, and then develop the most appropriate treatment plan for you.
Okay. Good.
So you can be successful.
All right.
Okay, that works?
Yep.
Okay. So, your name is Michael Brown.
Okay.
Michael Jones.
Jones.
I'm sorry.
Michael Jones.
Okay. And your birthday?
6/26/63.
6/26/63.
Yep.
And how old are you?
I am 51.
51.
Mm-hmm.
And you were born in this country?
Yes.
Okay. And your primary language is English?
Yes.
English. Okay. What sex were you assigned at birth?
Male.
And what's your gender? Some people see gender as being different from...
I'm a man.
Man, okay.
Yeah.
Okay. And your current housing situation?
Live with my dad.
Live with your dad. Okay. Have you been in jail or prison within the last 12 months?
No.
No. Highest level of education completed?
Bachelor's degree.
Bachelor's degree. You've done some college. Okay.
Yep.
Are you a veteran?
No.
No. Okay. So I'm going to switch now to some questions about your physical health.
Okay.
Do you currently have a health provider?
No.
No. What was the date of your last doctor's visit, approximately?
Well, let's say about 3 years ago after I left my job. So 3 years ago. Yeah.
Okay. Would you have any physical trouble or difficulty? I'm going to ask you to answer either none, some, or a lot. Walking up a flight of stairs?
None. I'm
None.
good. Yeah.
You played football before?
Yeah, I played in college.
Okay. So would you have any difficulty running a length of a football field now?
I mean, it'd be rough, but I can handle it. I say some.
Some,
'cause
okay.
I smoke too, so.
Okay. Not in the shape you used to be.
Nah,
I got you.
definitely not.
And I'm going to stretch out a little bit. I'm going to presume that you're not pregnant.
No.
Okay.
No.
Okay.
I said I was a man.
You did say that. Okay.
All right.
So these questions refer to just the last 7 days.
Okay.
And again, it's none, some, or a lot. How much trouble have you had with sleeping in the last 7 days?
I had some.
Some.
Just because of drug use, I guess, and then not having the drug, going back and forth from body and all of that. So
Yeah, a little withdrawal.
Yeah, the withdrawal and all
Okay.
of that. Mm-hmm.
How much trouble have you had with hurting or aching in any part of your body?
Only when I don't have the drug and going through withdrawal, that's the aches that I experience.
So in the last 7 days?
No, because I've been using heroin, so
Okay.
so I didn't have any aches.
None in the last 7 days.
Nope.
What about getting tired easily?
No, not really.
Mm-mm.
No.
None.
Mm-mm.
Okay. Feeling depressed or sad?
Yeah. When I think about my life and that sort of thing, where I am now, what I should have been, then I get depressed and sad. Plus, my mom and grandmother both been sick
Okay.
during this process too, so I've been sad about that.
So you've had some things on your
Yeah.
mind and on your heart.
Yeah,
And so we put some or a lot?
I put some.
Some. What about nervousness?
Nah, not too much.
None. Okay. So staying with the last 7 days, how often did you socialize with other people?
I don't. I'm usually a loner.
Okay. So that means you haven't done any religious or social activities, recreational?
Nah, not really.
No. You just stay to yourself.
Stay to myself.
Gotcha. So in the past 7 days, how often did you stay home in a nursing home, hospital, anywhere because you were sick or injured or had a health problem?
None.
None. So you
None.
haven't been confined because of that?
No.
Okay, great. And what about this? Have you had a cough or drenching night sweats or unexplained weight loss for 2 weeks or more?
No.
No. Okay. So I'm going to switch up now, and I'm going to ask you about whether these statements describe you or not. And I'd like you to either go with no, does not describe me, somewhat describes me, or yes, it describes me exactly.
Okay.
Okay? I like who I am.
Somewhat describes me.
Somewhat describes you. I am not an easy person to get along with.
Nah, that doesn't describe me at all.
That's not you.
No.
I am basically a healthy person.
Somewhat, except for hypertension.
Okay.
Big time hypertension, actually.
Okay. So that might be something we'll talk about.
Okay.
I give up too easily.
Nah, that doesn't describe me.
That's not you.
No.
I have difficulty concentrating.
Nope, that doesn't describe me either.
Nope. Okay. I am happy with my family relationships.
That describes me exactly. I am.
You are very happy with them.
Yep. They may not be happy with me, but that wasn't the question.
Uh-huh. And you said you stayed by yourself a lot, too.
Yeah. Yep.
Okay. I am comfortable being around people.
Even though I'm a loner, it somewhat describe me.
Somewhat describes.
Yeah, I don't have a problem with that.
Okay. So now, I'd like to talk. I'm talking about your whole lifetime. Have you experienced anything that was unusually or especially frightening, horrible, or traumatic in your life? An assault or combat, abuse?
No,
or anything?
no.
No traumas.
Nope.
Okay. So, let's see. For this one, just tell me which response best describes you. Have you ever thought about or attempted to kill yourself?
No, never.
Never. So that applies in the last year also.
No,
You said
never.
Okay. So let's switch. Let's switch up and talk about alcohol consumption. How often do you have a drink containing alcohol, including beer or wine?
Every other day, sometimes. I drink. I mean, I do heroin more, but I do drink.
You do drink.
Yes.
So you say maybe every other day. So maybe like 4 times a week.
4 times a week.
Okay.
Yeah.
Okay. How many drinks do you drink on a typical day when you do drink?
40 ounce of beer, maybe a half a pint of gin to go along with heroin. So,
Okay.
I mean, what's the scale?
Well, you say you drink a 40?
Yeah.
Uh-huh.
Yeah.
40, that's about 3.5 drinks.
Okay, well, then 3.5 drinks.
Okay. And that's it? You just do like a 40 on the day that you drink?
Yeah. And sometimes some gin, half a pint. It varies. There's no pattern.
Uh-huh.
There's no pattern.
It's no pattern.
No, there's no pattern.
So you can do 3 to 4, 5 to 6 drinks a day.
Yeah,
when
I
you
can.
drink.
Okay.
Okay.
But that wouldn't be every day, though. Heroin is every day, but
On the 4 or 5, on the on the every other day that you drink during the week, you can drink 5 or 6 drinks at a
Yeah,
time.
I can.
Okay. So in the past year, how many times do you think you had 5 or more drinks?
How many times?
Yeah, like once a month,
Twice a week.
twice a week. Okay. Let's go to tobacco products. Do you use tobacco
Yep.
products? Yes. And how often?
Every day.
Every day. Okay. How about other drugs? Have you ever used drugs such as marijuana, heroin?
Yeah, heroin. That's why I'm here.
That's why you're here. And in the past 3 months?
Yep, every day.
Every day. Okay. And what about for the past 3 months, marijuana?
Nope.
No. Cocaine?
A little bit. But that's
In the
not my drug of choice. In the past 3 months.
But you have used some in the
yeah, I
last
have
3
some.
months. Okay.
Yeah.
Amphetamines?
No.
Inhalants?
Nope, nothing else.
Nothing else?
Nothing else.
Okay, so just heroin and cocaine.
Yeah.
Okay. What about prescription drugs? Have you taken any prescription medication only for the feeling or the experience it
Nope.
causes?
Nope.
Have you injected drugs, steroids, or hormones?
Nope.
And what about sharing needles?
Nope. I didn't inject. I just snorted.
Just snorting?
Yeah.
And tattoos and piercing equipment, you
No.
share them? Okay. So in the past month, have you had sex while high, intoxicated, or drunk?
Oh, all the time.
All the time. Okay. So you feel more sexual when you're high or off of something?
Well, I don't know about so much sexual. That's what I did.
That's what you did?
Yeah, that's what I did. When I got high, I had sex.
So do you feel like you're maybe a little self-conscious about having sex when you're sober?
No, I wouldn't say that because when I was in school way back when, I had sex sober, so I don't even think that I'm so self-conscious. It's just what I did when I got high. Picked up women off the street, women who got high just like I did, and that's what we do. We got high and had sex.
Okay, that was just part of the program.
That was part of it, yep.
Okay. So, are you convinced that your sexual activity is a significant concern for your recovery?
Well, I wouldn't call it concern now because I'm planning on stop using drugs, and then if I do that, I don't think I'll be out in the street having sex with this woman or that woman. It just went together, so I wouldn't call it a concern right now.
So you're seeing treatment as helping you?
You're right. I wouldn't be doing that kind of behavior then.
But you seem to recognize how they are hooked up together.
Oh yeah, definitely.
Okay.
Definitely. Yeah.
That's really what I was asking.
Yeah.
Okay. Have you been sexually active with anyone in the last 12 months?
Yeah.
Okay. And in the last 12 months, have your sexual partners been male,
No.
female?
Yes.
How many?
Oh man, it's random. I don't know.
Random.
Yeah, I don't know.
Estimate from the last year.
That's been the last year. 50.
50.
And I wouldn't call them partners either. I wouldn't know what to call them.
Well, you say you prostitute some, right?
Well, yeah, I wouldn't put that. Just people I got high with, people who's in the same lifestyle as me. I wouldn't call them prostitutes per se.
Okay.
But sex for drugs and that sort of lifestyle that I was doing.
So the sex goes with the
yeah,
lifestyle
went with
for
it.
you.
Yeah, went with it.
Okay. Any transgender
No.
partners, intersex partners?
No.
Okay. So in the past 12 months, you've had sex with. Have you had a main spouse?
Nope.
No main spouse.
Nope.
Okay. So, but you've had casual partners.
Yes. Lots.
Anonymous partners.
Yes. Lots.
HIV positive partners.
No. Hope not.
Partner of unknown status.
No. Hope not.
You knew everybody's status.
Yeah, I guess.
That's not real convincing. Okay.
I was out there.
You
man.
out
I
there.
was out there.
Okay.
I was out there.
Intravenous drug users.
Yeah, probably. Yeah.
And MSMs, men who have sex with men. You said
No,
that.
definitely not.
Okay.
Now, I knew that much.
Okay. That was your limit, your boundary.
Yeah,
Okay.
definitely the boundaries.
In the past 12 months, when you've had sex with other people, how often did you or your sex partner use condoms or other barriers? Always, sometimes, never, not applicable.
Sometimes.
Sometimes.
But it's not good.
Okay. You recognize some risk there.
Yeah. I know right from wrong.
Well, I'm looking at it as what's healthy or not healthy more than what's right or what's wrong.
Yeah, that was a mess.
Yeah. So we're just trying to identify some risks so we can figure what's the best approach to helping you.
Okay, I'm ready.
Okay. Have you ever had sex in exchange for drugs, alcohol, money, or something you needed?
In exchange for?
Mm-hmm.
Not so much an exchange for, just went with it. So I say yes. So,
Say yes.
Yeah.
And you've had sex with other people who were doing the same?
Yep.
Is you don't have a current regular sexual partner?
No.
Okay. And your sexual orientation is you're straight?
Yes.
Have you ever been tested for HIV?
Nope, but I think I better.
You think it's time?
Yes.
Okay.
You can test me today if you like.
Okay, you're ready for it?
Yep.
Okay, we'll see
You
if we
need
can...
to know.
Need to know. That makes sense to me. Okay. What about these other STIs in the last 12 months? Gonorrhea?
No, because I haven't seen a doctor in the last 12 months, so you can
So
say
none of them? Chlamydia,
no,
syphilis?
No for none, all of them.
Okay. 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 Have you ever been tested for any of these?
Nope. Well, way back, yes, because I was seeing a primary doctor when I was working.
Okay.
4 or 5 months ago. Yes, I've been tested back then.
4 or 5 months ago?
4 or 5 years.
4 or 5 years ago.
4 or 5 years ago.
Gotcha.
Yeah, I've been tested before.
And do you remember the results for gonorrhea? Was it positive?
No, I was always negative.
It was negative
For everything.
Okay. So you had regular testing back then?
Yes.
And nothing came up positive?
No.
Okay. Great. Okay. So, Michael, can you tell me what kind of things you like to do to relax, for your leisure, to relieve stress, like that?
Well, if I wasn't getting high, I would say sports. I love sports.
Okay.
Yeah, I love sports.
Yeah.
I love to read, actually.
Is that right?
Yeah, I love to read. I love politics. I love a lot of different things.
So you have a lot of interests.
Yeah, a lot of interests. Yeah, I've just been consumed with the drug use.
It's kind of taking over things.
Yep.
Mm-hmm. Okay. Is there anything else you'd like us to know about you?
No, not much I can think of. Just wanting to get my life together, get off the drugs so I can get back to doing what I supposed to be doing.
So you're ready to get back on track?
Yeah, I'm ready to get back on track. I'm ready to start working. I'm ready to start doing something positive.
Gotcha. You
Yep.
want to be positive and want to take care of yourself.
Yep.
Great.
Yeah, I'm ready.
Okay. So thank you for that. We're going to take a couple minutes and score this, and then you and I'll talk about what the results are.
Okay.
Okay?
All right.
Great. So Michael, we have your feedback, and I'd like to share it with you. You actually scored real high on your resiliency factors, your strengths, the things that you have working for you. It says your emotional well-being is above average, your sense of self, your self-esteem, and even your social health.
Okay.
So that tells me that you have some fortitude, you have some strength with which to fight for your sobriety and your recovery.
Okay.
Your physical health, you're at the cutoff in terms of perceived health. So thinking that it might be good for you to see a primary care physician, especially since you hadn't seen one in 3 years.
Right.
Like
Okay.
that.
I agree with that.
So you agree with that?
Yep.
So on a scale of 1 to 10, with 10 being most ready, 1 being least ready, where would you score yourself?
A 10. I'm ready to see a doctor.
You ready to do that?
Yes.
Okay. Another area that you scored pretty good is on mental health symptoms. You're really below the cutoffs, and anxiety and depression, depression or anxiety separately, no trauma, no suicide ideation. So at this point, we're not seeing that you really need a referral for mental health counseling.
I wouldn't mind seeing one though.
You would mind seeing
No,
one?
I want all the help I can get.
Okay, so you'd like to have somebody to talk to about some of these issues.
Yeah, because I think I had to be somewhat sort of crazy, just all the stuff I used to do. So I wouldn't mind seeing someone.
You want to have somebody to help you check things out.
Yeah, it couldn't hurt.
Okay. All right, we can certainly do that. We can certainly do that. Then we come to substance abuse treatment. Substance abuse. Well, obviously you're here.
Oh yeah, I'm definitely
for
ready for that. So that's a 10.
That's
already.
a 10.
I'm ready.
So
I need to address that. That's why I'm here.
That's in terms of the heroin and the cocaine.
Yes.
Okay. What about the alcohol? Alcohol, you actually scored above the cutoffs also.
Yeah, I know. And I know I probably need to stop drinking as well. But I would give that maybe a 6.
Maybe a 6.
At the time. But I know since it's an abstinence program, I'm probably going to have to address that as well.
Okay.
Yeah, but my main focus is definitely on the heroin and cocaine.
So it's not as you're not as ready as you are for the heroin and cocaine.
No, not as. But I know I may probably need to address that as well.
Okay. So you might accept a referral for that.
Yes, yes.
Okay. Good. Tobacco. You said that you smoke regularly.
Yeah, pack a day.
Pack a day.
I can tell you now I'm not ready to stop that. Even though I know that I'm probably going to have to consider that I have hypertension. I know it raises my blood pressure, but there's so much other things on my plate, I'm definitely not ready to address that. So I will give it a 4, only because at some point I'd probably be willing to take a look at addressing smoking cigarettes.
So you realize it might be compromising your hypertension.
Yeah,
Okay.
I know.
And you want to deal with it, but you're not quite ready now because you think it might be overwhelming to do both at the same
I got a lot of
time.
other things on my plate right now.
Okay, so this is something that we can come back to.
Yeah.
Okay. All right. And what about the sex drug-linked behavior?
What about it?
You were actually over the cutoff with that. Was when you talk about having 50 partners in the last.
That goes with my drug use.
That goes with the drug
so
use.
if I'm addressing the drug use, the sexual behavior will go away. So I don't have no problem with it.
So you don't think that's an issue that needs some separate attention?
No, because I think it all ties to the drug use. Like I told you, when I got high, I had the sex. Now I'm not getting high, I won't be having the sex. So that's not even an issue.
So you're going to stop having sex altogether now?
Yeah, people randomly off the street, and I'm doing that because I'm getting high and they get high. So once the substance use behavior goes, that's going to go. So there's no need to address it in no specific way.
Mm-hmm.
It's not a problem. The drug use was the problem.
The drug use is the problem.
Right.
And all of this anonymous and...
all because of the drugs.
Okay.
All because of getting high.
Okay.
I wouldn't even know half those people's name. If I was sober, I wouldn't look at them twice.
Got you.
That's simple.
And you don't have a main partner right
nope.
now?
Not in my cards. I'm trying to focus on the drug use. The women, that's out right now.
So you're not going to do sex at all?
I'm not even thinking about it.
So I'd like to know, on a scale of 1 to 10, how ready are you to get some...
Oh, that's a 0. I don't even need to address that because it's the drug use. Once I stop the drugs, that high-risk behavior automatically will go away. So I don't even need to address that. That's just going to happen.
So you're convinced that this is going to happen if you stop using the
I
drugs?
know it because that's why I did it. I did it when I was getting high. I'm planning on not getting high. So
you plan on not having?
Right, so therefore I'm not going to be out in the street tricking again.
Got you. And what about sex? You plan on not doing sex at all?
Right now I'm concentrating on myself. And when that time comes, hopefully it will be with someone who I care about, who's not using, and building a relationship the right way. The random sex with random women, that's out. Especially if I get tested and I come back negative. That means I'm starting from 0. So there's no way I'm going to go back out in the street after hopefully getting past without having any diseases and then starting over, only to go back. I'm not gonna do that. So they need to address that. I don't need no extra help.
So you're not looking at not doing sex. You're looking at changing your sex behavior, and you think that you can do that. You have that under control.
Right now, I'm not even thinking about sex at all. I'm just thinking about getting myself together, getting off of drugs.
Okay.
But what I can tell you, I'm not gonna be out having random sex with different women like I was when I was getting high. I can tell you that much.
Gotcha. Okay, so while you're in this transition from moving from having random sex with a lot of different women to finding a mate, how about we revisit this at some point? I know you're 0 right now for getting help, but we look at it again, monitor it as you go through treatment, and see if at some point some help might be appropriate.
Okay, I can do that, but the first thing, I need to get tested. See, once I get tested, and God willing that I'm negative, then I start from 0 then. So it'd be crazy to get negative, only to go back out there and put myself at risk. That's why I'm here. I want a clean slate. So just by automatically, I'm not gonna go out in the street anymore, especially if I'm negative. Now, if I'm not negative, then we got other problems.
Okay.
But for right now, that's why I want to get tested so I can start over.
So you want to know where you are?
Yes, so I can start from now.
Okay.
And that means the high risk stuff is done, dead. I'm through.
So you think you're going to be able to cut it off just like that?
Well, the drug use, that's why I'm here. It's go hand in hand.
We'll monitor it.
Okay.
And we'll see how it's going, and if you need some more support at some point.
Okay.
Is that a deal?
Yep, that's a deal.
Okay, great. What else do we have? We have, well, you said the testing.
Yep, you can do that today.
Oh, you ready for that?
I'm ready for that now.
That's a 10 or above.
I got to know. That's a 10 or above.
Okay, let's see. Can we do that? Case management.
Yeah, if it helps.
Yeah, case managers help to organize all of this and any other referrals that you might need. So.
Okay, I'm willing to do anything. I mean, I'm open to suggestion. I just don't think you got to do all that sex stuff.
Okay. Number for the case management? 10?
10.
Yeah. Okay. Great. Okay. Well, we're going to fill out this and give you a copy. I'm going to add this mental health since you want this.
Okay.
This says we identify some physical health issues and substance abuse issues, infectious disease issues. And we're going to fill this out with the referral data so you can have this to keep with you as a reminder.
Okay. All right.
Any more questions for me for today?
No questions.
Okay. Well,
I'm ready to get started.
Ready to get started.
Yeah, because I don't get myself back together. I need to start working again, and I need to set some goals for myself.
Yeah. Well, good luck on that.
All right.
And it's been a pleasure working with you today. Yes, sir.
Okay, thanks.